Izin mulai ya, Bapak Ibu ya. Bismillahirrahmanirrahim. Honorable Secretary of Universitas Indonesia and Chairman ITTP Conference 2022, Dr. Agustin Kusumayati, MSc PhD, Director of Research and Development, Universitas Indonesia, Mr. Munawar Khalil, PhD, the Dean of Faculty of Public Health, Universitas Indonesia, Professor Dr. Mondasri Khalib Sudaryo, Principal Researcher of G20 Research-Based Policy Grant, Professor Dr. Anda Fatma Lestari, MSc PhD, our distinguished speakers, all participants, ladies and gentlemen. Assalamualaikum warahmatullahi wabarakatuh and good afternoon everyone. Welcome to webinar Harmonization and Strengthening of Global Health Standards and COVID-19 Recognition Protocol. Today's event, Friday the 1st of July 2022, is organized by Disaster Risk Reduction Center Universitas Indonesia, or the RRC Universitas Indonesia, the Faculty of Public Health Universitas Indonesia, and the second ITTP conference COVID-19, supported by the Director of Research and Development at Universitas Indonesia. It is expected that this webinar is to sharing an improvement of the various experiences and knowledge, as well as the latest policies regarding the COVID-19 protocol, in order to realize the harmonization of the COVID-19 protocol between G20 countries and potential areas for improvement. I would like to welcome to our speaker, Professor Dr. Eko Supriyanto, University Technology Malaysia and ITTP, Dr. Imran Pambudi, MPH, Health Quarantine Coordinator of the Ministry of Health, Republic Indonesia, Professor Dr. Hasbuah Tabrani as Professor of Faculty of Public Health Universitas Indonesia and lead co-chair T20 Indonesia, Dr. Anthony P. Sanjaya, PhD candidate as Health and Economic Overseas Indonesian Student Association, all lecturers from Universitas Indonesia, welcome to all participants, fellow students, alumni, as well as practitioners from various countries for attending this event. I would like to introduce myself. My name is Abdul Qadir, lecturer in Occupational Safety Department, Faculty of Public Health, and I will be serving as master ceremony of today's webinar. And ladies and gentlemen, I will explain the schedule for today's webinar. The event will be started by safety induction video until the Q&A section. In accordance with the requirement of the health safety aspect in Universitas Indonesia, for the safety region, we will display the safety induction video. Please keep attention for this for the health and safety aspect.
Welcome to Universitas Indonesia. According to safety rules and regulation in Universitas Indonesia, we are Occupational Health, Safety and Environment Unit would like to deliver safety induction to avoid discomfort or injury during online activities. Please pay attention to this induction. If the participants are in the same room during these online activities, all participants must follow health protocol. All participants must wear medical masks. All participants must keep physical distancing. Please make sure your mobile data or Wi-Fi is sufficient to participate during online activities. Please make sure your sitting position is ergonomic. Keep your back straight and keep your head upright. All participants must follow 20-20-20 method to avoid radiation exposure and eye strain. Every see screen 20 minutes, look at something 20 feet away and take a 20-second break. Please do stretching during online activities, especially stretch on your shoulder, neck, and wrist. For electrical use, pay attention to your electrical devices. Make sure all electrical wires are in good condition. Use your electrical socket safely. Make sure you already know the emergency alarm sound. In case of fire or earthquake, please stay calm and do not panic. Call the emergency contact number, evacuate yourself immediately, and follow floor burden instruction. Do not engage to dangerous activities. Please do not use your mobile phone while driving or riding during online activities. Please do not smoke and keep the environment nice and clean. And please do not litter. Thanks for your attention.
Thank you very much, everyone, for the attention. For a brief moment, we would like to invite you to rise and sing Indonesian anthem, Indonesia Raya. May all we rise. Thank you. Ladies and gentlemen, before we start, I would like to expect you to listen to these following matters. First, turn off your microphone as well as your video. You are not allowed to share screen during this event. And if you have any question, please write it down through the Q&A section with the format name of participant and the question. And if possible, we would like to allow and invite you to ask directly in the Q&A section. And it is expected as well that all participants to fill in the attendee list on the link that we sent via the chat column by our committee for the certificate purposes. And next, I would like to invite our panelists to take picture together. So please activate your video for the panelists. Okay. Okay. 3, 2, 1. Once again. 3, 2, 1. Okay. Thank you very much. And we are now going to listen the welcome speech from Universitas Indonesia as well as ITTP Conference 2022, delivered by the Secretary of Universitas Indonesia and the Chairman of ITTP Conference 2022, Dr. Agustin Kusumayati, MSc, PhD. And ladies and gentlemen, please welcome Ms. Agustin Kusumayati.
Thank you, Mr. Abdul Qadir. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Very good afternoon for everybody from the campus of Universitas Indonesia at Depok, East Java. It is an honor for me to welcome all of you to this pre-conference event as one of the activity of the before we are coming to the second international teleconference on technology and policy towards COVID-19. Collaboration between Universitas Indonesia and University Technology Malaysia. Last year, we had conducted the first ITTP COVID-19, and it was considered as a successful one. So this year, we continue the collaboration by conducting this second ITTP COVID-19. And for this year, the Universitas Indonesia became the main host. Ladies and gentlemen, as we know, now we are getting better in terms of the pandemic of COVID-19. We are now in the phase of recovery, and we really want to recovery faster and achieve better situation in not only in our country, but also in the regional as well as global community. So one of important aspect how we can improve or we can recover faster is by allowing higher and more productive people mobility within the country and also across countries. So when we want to improve or increase the people mobility, one of the important thing is how we can keep controlling the pandemic. So how we can identify and how we can control COVID-19 as a disease, sorry, is very important. So that's why today we will have a workshop on how we can harmonize globally the health standard protocol towards COVID-19. So in this case, let me thank all parties who have been supported these activities. First, to the Dean of the Faculty of Public Health, Professor Mundasik Korib, that already allow us and allow all the staff from the faculty to support and conduct this workshop. Secondly, let me deliver my gratitude to the University of Indonesia, especially to the Directorate of Research and Development. We will listen after my welcoming remarks, a remark from the Director of Research and Development Directorate, Universitas Indonesia, Mr. Munawar Khalil. And then let me also send my gratitude to the vice chairs of this ITTP COVID-19. We will have the Professor Eko from the University Technology Malaysia will be one of the speaker for today's workshop. And we will have Dr. Brian Supriyastuti as the moderator of today's workshop. So thank you so much for your support so that today we will have this workshop and hopefully we will have a productive workshop. Thank also to all the speakers that we will listen to their experience, their thoughts about how we can harmonize global health standard protocol towards COVID-19. We will listen from University Technology Malaysia. Professor Eko Supriyanto himself will be the resource person. We will have Dr. Imran Pambudi from the Ministry of Health, Republic Indonesia, and Dr. Antoni Sunjaya from the Persatuan Pelajar Indonesia Dunia from the World Indonesian Student Association, and of course from Professor Hasbullah Tabrani as the lead co-chair of the T20 Indonesia. So thank you so much for all your contribution so that this afternoon we will have a workshop and hopefully this workshop will be a productive one. Last but not least, thank you so much for the principal investigator of this policy brief or white paper that will be produced from or based on our discussion. Professor Fatma Lestari is the principal investigator from Universitas Indonesia. Again, thank you very much. Shall we have a fruitful discussion and may we have productive result and also will give benefit to all the people, not only in Indonesia, but also in the region. Thank you and have a pleasant workshop. I return back to Mr. Abdul Qadir.
Thank you very much, Dr. Agustin, for a very great welcome speech. And for the next opening speech will be delivered by the Director of the Research and Development Universitas Indonesia, Mr. Munawar Khalil, PhD. And I will invite Mr. Khalil. Time is yours.
Thank you, Pak Abdul Qadir. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Selamat siang dan salam sejahtera untuk kita semua. Very good afternoon, everyone. Yang saya hormati Ibu Dr. Agustin Kusumayanti, MSc PhD, University Secretary Universitas Indonesia. Yang saya hormati Bapak Profesor Dr. Mondastri Korip Sudaryo, Dean of Faculty of Public Health Universitas Indonesia. Yang saya hormati Ibu Profesor Fatma Lestari, Research Team Leader at Disaster Risk Reduction Center, DRRC Universitas Indonesia, Your Excellencies, keynote and invited speakers, moderators, participants, ladies and gentlemen. It is indeed my privilege to be invited to give remarks on behalf of Directorate of Research and Development, Universitas Indonesia, in today's workshop entitled Harmonization and Strengthening Global Health Standards and Protocols for COVID-19 Recognitions, organized by the Faculty of Public Health, Universitas Indonesia. As we know, this event is designed as an avenue for exchanging ideas and brings together scientists and policymakers to formulate various recommendations to support the role of Universitas Indonesia, especially the Faculty of Public Health as the university partner for the Indonesian's presidency at G20 meetings. Ladies and gentlemen, it is not a secret that formulating evidence-based policy recommendation is a form of real contributions from academia in translating research findings so that they have practical implications for policymakers and the community. The challenges facing Indonesians and global society today opens up opportunities for scientists like us to not only conduct multi and interdisciplinary collaborations, but also an avenue for dialogue to contribute for strengthening the global resilience toward the current COVID-19 pandemic, even though it's getting better right now, as well as any potential incoming future pandemic possibilities. The Office of Vice Rector for Research and Innovations, through our unit, Directorate of Research and Development, has always been committed to support UI researchers and the academic community to discuss and identify crucial issues in global health, standard and protocol for COVID-19, so that they can be transformed into science-based policy recommendations to SERPA office at the G20 Indonesian presidency. Other than support in the form of research funding that have been available for UI expert team to develop policy recommendations to SERPA office at the Indonesian's G20 presidency, which Prof. Fatma has one of our principal investigators. I'm also delighted to share another contributions to the Indonesian G20 presidency from Universitas Indonesia. As you might have remember, a few weeks ago, Universitas Indonesia has handed over to 2 units of fully electric low entry bus to the government for the use in G20 summit in Bali next October until November. This EV bus are innovations from innovation products from research in Universitas Indonesia, collaborating with our industrial partners. We hope that this could be an example for future research and technology product designs, as well as a good collaborations in the form of triple and helix collaborations, as well as improving the manufacturing capacity to this prototype can be mass produced with the new project. Finally, I wish you insightful and fruitful discussions. I hope this workshop could strengthen the role of Universitas Indonesia in boosting the G20 Indonesia presidency. Terima kasih. Wassalamualaikum warahmatullahi wabarakatuh. Back to you, Pak.
Thank you very much, Mr. Khalil, for your great welcome. And then I would like to invite the Dean of Faculty of Public Health, Universitas Indonesia, to deliver opening speech delivered by Professor Dr. Mondastri Korip Sudaryo. To Professor Mondastri Korip Sudaryo, time is yours. Is here. Okay. I think Professor Mako still connecting. Okay. Okay, hello, Professor Mondastri.
Wait. Aja.
Saya ada.
Pakai ini saya aja.
Ini buat suaranya.
Halo, Dr. Mako. Okay. Meanwhile, waiting Professor Dr. Mako, I would like to welcome to Professor Dr. Eko. Welcome to webinar, Prof. Yeah. Okay. Hello, Professor Mako.
Okay. Hello. Hello. Can you hear me?
Yes. Yeah. Welcome.
Okay. Okay. Thank you. Okay.
Hello.
Sorry,
Yeah.
still have a problem with the internet. Just for a second.
Okay.
Hello. Good afternoon.
Good afternoon, Professor Mako.
Good afternoon, dear distinguished colleagues and participants. Good afternoon. I'm sorry for a bit late. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi
And welcome
wabarakatuh.
all the honorable leaders of University of Indonesia, as well as honorable speakers, Dr. Agustin Kusumayati, the Secretary of University of Indonesia, and also the Chairwoman of second ITTP conferences, and Dr. Munawar Khalil, the Director of the RPM, University of Indonesia, Prof. Fatma Lestari, the Chairwoman of the RRC, University of Indonesia, Dr. Michael Ryan, Executive Director of WHO, and Professor Eko Supriyanto, our colleagues from University of Technology Malaysia, the Vice Chairman of second ITTP conference, Mr. Setiaji, the Chief Digital Transformation Office, Kemenkes RI, Dr. Imran Pambudi, the Health Quarantine Coordinator, Kemenkes RI, Professor Hasbullah Tabrani, our professors, co-chairman of T20 Indonesia, and Dr. Antoni Sunjaya, Director of Research and Policy, PPI Dunia. Allow me to also greet the honorable chairs of workshop, Dr. Brian Sri Prahastuti and Dr. Hendy Kristianto. Similarly, my greetings to all honorable participants of the workshop. Today, as part of several events of the second ITTP conference, the Faculty of Public Health, University of Indonesia, and the RRC UI proudly host and organize this workshop entitled Harmonization and Strengthening Global Health Standard and Recognition Protocols of COVID-19. This current issue of harmonizing and strengthening, as will be addressed and issued by many experts here in detail, are very important due to wide variation of standards and protocols across countries. So one of the main objectives of this workshop is to formulate policies that can support harmonization and strengthening of the global standards and the recognition protocols of COVID-19 as a global perspective. As today is also our 57 years of birthday of our faculty, we hope that this important workshop could be considered as our contribution to the nation under the G20 agenda. I wish all distinguished participants can have fruitful and meaningful discussion and finally enlightenment. Please enjoy the workshop and thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Professor Mako, for your speech, and happy Disnatalis for Faculty of Public Health.
Thank you very much.
Okay, and now we're gonna start the presentation by the speaker of the first session, who will be guided by the moderator, Dr. Brian Sri Prastuti, MPH. But before it, allow me to introduce our moderator. Mas Bangga, can show. Yeah. Yeah, I will introduce Dr. Brian. She's graduated from Universitas Indonesia for the doctor degree, and now she assignment has a lot of experience, such as Dr. PTT, Departemen Kesehatan Republik Indonesia, Supplementary Food Program Coordinator, and Health Specialist in the UNICEF, Program Manager in Child Fund, and Senior Area Manager in the Save the Children. And now she's working as the Tenaga Ahli Utama Kantor Staf Presiden Republik Indonesia, with the experience in the organization such as PP Pergizi Pangan from 2019 to 2024, and Dewan Pakar Masyarakat Ahli Kebijakan Publik Indonesia, as well as Vice Chairperson of ITTP COVID-19. Without any further ado, I would like to invite Dr. Brian to hand over this session. Thank you very much.
Yes, thank you very much, Mr. Abdul Kadir, the Master of Ceremony. Ladies and gentlemen, as introduced previously, my name is Brian Sri Prastuti, who will be the moderator for this session for about 1 hour and a half. And together, we are following the process of today's event from the group discussion that conducted in the morning, then the statement, the openings from the opening speech from our honorable host of University Indonesia, and then while in the same time survey is still running until the next 2 weeks, expecting to have more voices, more information gathered from the representative of G20 countries in collaboration with World Indonesian Student Association. We believe the voices of civil society is valued and critical to provide input to the policy makers towards G20 summit, which will be conducted in the Q4 2022, in which Indonesia is the presidency. In this session, we will listen updated information and knowledge from the respectful speakers about the importance of harmonizing global health protocol standards, the need and the gaps, particularly toward the COVID-19 endemic area that mentioned very clear previously by our honorable speakers in the opening speech. Yeah, many countries already moved from the pandemic to the endemic, but the disease itself is not yet disappear from the world. And also to anticipating the potential pandemic in the future. So with us now, there are two speakers for this session, for this first session, representative of international and national. We have Professor Fatma Lestari and also Professor Eko Suprianto. For the OC, please. Yeah. Okay, so excuse me. Yeah. So I would like to please Professor Fatma Lestari for the first opportunity, but before that, we can see in here her profile. Professor Dr. Anda Fatma Lestari, MSc, PhD, is currently serving at the Disaster Risk Reduction Center, Universitas Indonesia, and Faculty of Public Health, Universitas Indonesia. Her expertise are around the disaster risk reduction and health safety. She is also very productive researcher, a writer, and actively involved in many working groups related to those areas of expertise at UN and also at the national level. So without any further ado, please Professor Fatma for the 25 minutes presentation. And for the participant, if you have any queries, you can write down the question into question and answer box, so we can select later after the presentation for discussion, if time is still allowed. Please, Professor Fatma, screen and time is yours.
Thank you very much, Dr. Brian, for the introduction. Allow me to present about our research-based policy for G20 recommendation. As UI, as academic partners of G20, so Universitas Indonesia, as previously explained by Dr. Munawar Khalil and also Ibu Dr. Agustin, that UI has several research-based policy grant, and one of them is our team. Our team, including myself, from Faculty of Public Health, Universitas Indonesia, Occupational Health and Safety Department, as well as Disaster Risk Reduction Center Universitas Indonesia. Today, we would like to share about our research-based policy temporary initial results, that this morning we have done a short survey, online survey, followed by focus group discussion. It was a very active discussion as well as very active online questionnaire survey. So our title is Harmonization and Strengthening of Global Health Standards and COVID-19 Recognition Protocols. Next slide. Allow me to introduce our team, myself and our best colleagues from Kantor Staf Presiden Republik Indonesia, Dr. Brian Sri Rahastuti, MPS, for her outstanding contribution. Dr. Hendy Wijaya, Andrio Adi Wibowo, MSc, Abdul Qadir SKM, MSc, our MC today, and Bangga Agung Satria SKM from Faculty of Public Health, Nurse Yudi Aryasta Chandra SK PhD from Faculty of Nursing, as well as from Persatuan Pelajar Indonesia Dunia. Mbak Ulan Kusuma Wardani SKM from DRRC UI, Disaster Risk Reduction Center Universitas Indonesia, dan Mbak Fira Azahra from Faculty of Medicine Universitas Indonesia. Next slide. The background of our research-based policy and the literature review result, that we already know that WHO currently COVID-19 protocol and interoperability has launched and published WHO digital documentation of COVID-19 certificate. Test result, technical standard and guidance document on the technical requirements for issuing digital certificate for SARS-CoV-2 diagnosis test result on 30th of March 2022. WHO also mentioned about the importance of interoperability standards for a digitized test result certificate facilitated by a common digital architecture that can be used as proof of negative test result or proof of previous SARS-CoV-2 infection for international travel, or as a means for protection policies that reduce public health risk in public or private venues. Next slide. Another consideration is to enable the establishment of interoperable trust networks and the trusted exchange of COVID-19 certificates and other health data, such as routine immunization data, home-based records, consistent with IPS between systems. WHO will convene a technical consultation on interoperability between digital health trust networks in collaboration with the Organization for Economic Cooperation and Development, OECD, and the Global Digital Health Partnership. Next slide. From the perspective of Indonesia, at the first meeting of the group of G20 Health Working Group, which was held in a hybrid format from March 28 to 29, 22nd in Yogyakarta, an issue on global standard for health protocols to promote safer called for the standardization of digital vaccine certificates, but also technology shared to develop digital that can be recognized across multiple countries for international travel. Namely, in Indonesia, we call it Aplikasi Peduli Lindungi. The G20 members had responded positively to the Indonesian initiative and unanimously agreeing to align their health protocols under a global standard. This is the picture of agreed to establish digital COVID-19 vaccine certification that would be recognized by all participating countries. Next slide. The first step in developing a mutually recognized digital COVID-19 vaccine certificate was to set up a universal online verification portal. G20 countries linked within the system will be able to verify vaccination data with each other. Since Indonesia has developed a universal certificate verification portal according to WHO standards, other countries would not need to change their existing system or QR codes. Mutual recognition of digital vaccine certificates was a safe solution for international travelers who struggled to have their vaccine certificates recognized by destination countries. Next slide. However, there are some problems facing. Despite the progress of COVID-19 protocol that currently has been accepted by G20 country members, there are still gaps. Several issues that needed to be improved and prioritized include COVID-19 test result, COVID-19 vaccine certificate, COVID-19 test operability, COVID-19 data infrastructure and ecosystems, and anticipating future potential pandemics. Next slide. In accordance to provide recommendation based on the research-based policy, our objectives are to formulate a research-based policy regarding harmonization of global health protocols in G20 countries, provide recommendations for COVID-19 harmonization of global health protocols in G20 countries, including COVID-19 testing result, vaccine certificate, data interoperability and data infrastructure, and anticipating future pandemics. Next slide. Our methodology includes literature review, which examines documents related to COVID-19 test recognition protocol, including regulations, academic texts, and research reports by using several primary keywords. And then followed by survey and FGD through webinar this morning to capture national and international civil society and expert opinion and recommendations. And today we have a webinar for presenting from the different perspective, global ASEAN, Indonesia perspective, as well as from young Persatuan Pelajar Indonesia perspective. We are also divided into online survey, focus group discussion, and keynote speaking sessions. This will provide full sets of recommendations in the priority areas of harmonization for COVID-19 tests, harmonization for COVID-19 vaccine, harmonization for COVID-19 test operability, harmonization for COVID-19 data infrastructure, and harmonization for anticipating future potential pandemics. Next slide. Priority areas number 1 is to harmonize for COVID-19 test result. As we know, the requirements for COVID-19 test ranges from PCR, swab antigen, and rapid tests. These are very dynamic currently. The condition is determined by the dynamic of COVID-19 cases in Indonesia, and this can cause difficulty when someone traveling overseas. Then it is urged to make sure that the recent conditions of COVID-19 in a country along with the test requirement should be communicated to the destined countries abroad. A G20 country members is urged to update these types of COVID-19 test prerequisites and at least achieve a global standard for COVID-19 tests. G20 country members is urged to implement semantic data standards that have been appropriately qualified by a sole authoritative source. It is also recommended that codes for laboratory data should be interoperable using the principle of describe the same test the same way every time. Next slide. Okay. Another priority areas, next slide, including the COVID-19 vaccines. The harmonization for COVID-19 vaccine certificate. Currently, there is a wide variety of COVID-19 vaccines. Then it is suggested that a count is COVID prerequisite and at least achieve a global standard for COVID-19 vaccines. Next slide. Boleh dibantu Mbak Tira, next slide.
It has been the next slide.
Oh yeah, maybe my internet slow response. All right. Okay, the third priority areas, including harmonization for COVID-19 test operability, the adoption of digital health applications, and the availability of information technology or IT infrastructure in lower and middle income countries also needs to be addressed. Considering COVID-19 test operability, then it requires a policy to ensure that COVID-19 test adapts to every changing situation of the pandemic in each country that affects a significant impact on the formulation of COVID-19 rules and their implementation. As a result, the regulation in each country shift and develop according to localized conditions. A COVID-19 test regulation and verification should be able to minimize the confusion and uncertainty among international travel to the differing standards and systems for verifying COVID-19 tests documents, since this can increase additional travel costs. Next slide. To continue the harmonization for COVID-19 test operability, setting a standardized global health protocol and operability will hopefully create ease in mobility for international travelers. If the government enforces the interoperability rule right now, health facilities would need to upgrade their health IT systems. In this case, healthcare providers and labs must exchange and report information and share health data, include test order and result electronically using widely available standards through application programming interfaces or APIs. Next slide. The next priority is harmonization for COVID-19 data infrastructure. Public health information infrastructure has ability to support large-scale coordination. It requires a concerted initiative to overcome complex sociocultural, ethical, legal, and trust dimensions that underpin all of and further engagement of at-risk or undeserved communities. Data infrastructure resource incurs massive costs paid by various public and private institutions and internal HPO resources. Then it requires alternative for preparation, installation, storage, maintenance, and utilization of each COVID-19 data. Next slide. The last priority areas are the harmonization for anticipating future potential pandemics. G20 country members should, in the beginning of the pandemic, show unity, strengthen future collaboration that should be implemented by recognizing that there is a more coherent, multi-sectoral, multi-stakeholders, and whole of G20 community approach in ensuring G20's timely and effective response to the future pandemic. In the future, and to deal with the future potential pandemic similar to COVID-19, the G20's health systems need to have the ability to absorb, adapt, and transform in dealing with the shocks. There should be a worldwide implementation of the universal verifier in preparation for a future outbreak, pandemic, or other diseases, including monkeypox, unknown hepatitis, or unknown etiology mitigation. Next slide. This morning, we conduct an online survey. However, we still need your contribution, active participation for this online survey. You can still contribute and providing recommendation to G20 countries through this online survey. We would like to know your perspective, your opinion towards harmonizing COVID-19 global health standards protocol and recognition. So please join our online survey. This is the link, and you can also scan the QR code. So this online survey will be open until the next 2 weeks. So please share to your colleagues, your networks, and as well as to your students or other potential respondent. Next slide. This morning, we also conduct focus group discussion with the priority areas number 1 and 2, harmonizing global health protocols for COVID-19 testing and vaccines, which facilitated by Dr. Brian and the team, and the breakout room 2, which priority areas number 3, 4, and 5, harmonization for COVID-19 data interoperability, infrastructure, and recognition, which has been led by the lead of facilitator, Dr. Hendy Wijaya, Andrea Wibowo, and Abdul Qadir and Wulan Kusuma, and the team. Okay, next slide. So these are the results of some of the pointers, the most important pointers from FGD Outcomes Breakout Room 1. First pointers, harmonizing COVID-19 global health protocols is deeply important. There are some consequences if the harmonizing is having a problems or gaps, such as including financial or cost consequences. There are several potential problems for harmonizing global health protocols, including different terminology, different health policies, different health infrastructures, and health system. Future pandemic are likely to happen. We need a global health standards for doing the temperature check, vaccination, COVID-19 and beyond, mask and mobility restrictions, but these are situational, including to continuing to provide education and health promotion. We identify barrier factors, including each country's ego. However, the group also identified several success factors that each country's lesson learned with their own culture and compliancy behavior and protocols can be adopted for global health, for harmonizing global health protocols. Next slide. And some pointers from FGD outcomes from breakout rooms regarding the health risk factors data, electronic health data to be recognized, and interoperability. Several items discussed. How to harmonize and recognition needs to be done among G20 countries. Several lessons learned from COVID-19 pandemic has a physical and mental impact on everyone. Potential of indigenous knowledge and community applying the same service standards among G20 countries to health services. Health protocol must be maintained. Health risk factors need to be shared to all countries, especially when traveling, and the use of technology to mitigate future pandemic risks. Next slide. We have identified several problems. There is no regulation for interoperability of health data in Indonesia and in the world, so that the same can be treated in different countries. Health factors, especially based on status, need to be informed before traveling so that they can find out possible problems at destination country. Several mechanisms are provided as a recommendation that clear regulations for interoperability and duration of sharing among countries for health services of other posts. Health data needs to be owned and carried by personal data sharing is enabled by personnel. Next slide. Okay. Principally, we urge that the G20 state members to keep the vigilance and in state by data collected at the grassroots level. To invest more on system information Hello, everyone. Sorry, I apologize. I've been kicked out from the webinar. Okay, let me continue my sharing. Yeah. Sorry, I cannot see the PowerPoint, but is it only me or? Okay, it's appear. Okay, the debottleneck the access of telemedicine among G20 state members. We hope those recommendations to be developed because we believe those recommendations are doable and feasible, and high-income G20 country members already have the required infrastructure and manpower. Next slide. Okay, allow me to close my video. So in order to keep continue connecting with the webinar internet. We would like to also share our temporary initial online question.
Prof. Fatma? Hello, Prof. Fatma? We cannot hear your voice actually.
I apologize again, Dr. Brian. My internet connection is not stable. Sorry. Okay, the next slide is these are the demographic distributions. Some of them already having COVID-19 management in any capacities, and with the several different working duration from the majority is less than 6 months, and the position including from the majority is from the researcher. And under what capacities, the highest part is a researcher. Next slide. The next one is basically most of them agree to use non-PCR test method for COVID-19 screening. I think this is mostly everyone hoping that another types of non-PCR tests, and agree to use non-PCR test method for COVID-19 screening, such as because this is some the reasons that PCR is costly, time-consuming, not comfortable, and others. Yeah. Which method do you think should replace the PCR test for international travel, including nasal swab antigen, saliva antigen, the most preferable, while electronic knows some of them, and also the highest number is hoping that artificial intelligent AI-based screening, such as cough recording, could be used to replace or as alternative of COVID-19 screening. Next slide. These are some results from COVID-19 vaccination. Yes, 100% of the respondents have already get vaccinated. So this is very good. And what types of vaccine they have had? The highest is Sinovac types. And then the second one, Moderna, followed by Pfizer and AstraZeneca. And how many times? Most of them are already 3 times, and some of them are 1 or 2 times. And most of the respondents willing to share vaccine certificate for international traveling, which is good news. Next slide. And most of the respondents have been quarantined for COVID-19 before, maybe due to high number of COVID-19 cases at that time. Where were you quarantined? Some of them are in the hotel, in the house, and in the hospital, and some of them are not applicable because maybe they haven't experienced the quarantine for COVID-19. And also, do you agree to be quarantined if your COVID-19 test results are negative after your international arrival? I think this is 50-50, yeah, yes or no. Some of them 50% yes, and some of them no. And do you agree being checked for temperature? And 100% agree. Next slide. Do you agree to disclose your vital signs while traveling? 100% agree. Which vital signs do you agree to disclose? Most of the respondents say that temperature is preferable. But however, for blood pressure, saturation of oxygen, heart rate, body mass index, only some of them. And a few of them can allow to share COVID-19 history and health diseases. And another symptoms as well for traveling internationally. And we identify which symptoms do you agree to disclose. And most of them shortness of breath, willing to disclose, while the rest are partially. Next slide. About COVID-19 declaration, some of the respondents agree to disclose medical history electronically while traveling internationally, which is quite large, yeah. And which medical history do you agree to disclose? Most of the participants agree to disclose. Most of them is the pulmonary disease, while the rest are only partially. And most of the respondents agree to use mobile apps to verify health declaration. And we identify several personal data to agree to disclose, and most of them are age, yeah, willing to disclose. And passport ID, mobile number, and gender are partially agree to disclose. Next slide. Health data declaration, 100% the respondent agree, while partially only the influenza are sharing health data declaration, while the rest are partially few of the respondent agree to disclose. And also electronic health records for international medical consultation or telemedicine, most of the respondents agree to disclose electronic health records. Next slide. When we ask about...
Excuse me, Prof. Fatma, yes? You still have 1 minute left actually.
Oh, okay. I think last part, Dr. Brian, thank you so much for reminding. Yeah, we also identified and the participant recommend strategy for maintaining business and social activities during pandemic. So including using of proof of vaccination, COVID-19 testing result, quarantine, and etc., and social distancing. And the likelihood of future pandemic are some of the respondents are expected the potential or likelihood of future pandemic. Next slide. Yeah, this one potential types of disease that may be coming up in the country. The respondent living at the moment identified hepatitis the most, and then monkeypox and tooth and mouth diseases. And what is the best way? And the recommendation of the respondent are including several this following global health protocols. Okay, yeah, several strategies also provided. from the respondent, including the sharing of the electronic health records. Next slide. I think the last part, this one, restrictions. Yeah, some of them are already agree and also should be removed. Most of them are quarantine. Yeah, should be removed. Choosing the rest are some partially. Thank you very much, Dr. Brian, for your also your strong contribution to our research-based policy. Yeah. But anyway, Dr. Brian, this is only initial survey, so we are expecting everyone to join. And allow me to also thank you very much to Professor Dr. Eko Supriyanto for providing the initial online questionnaires to us that allow us to develop and modify the questionnaire. Thank you very much, Dr. Brian, Dr. Eko, Prof. Eko. Yeah.
Yes, thank you very much, Prof. Fatma Lestari, for your insight and also share to all participants in here the initial result of our survey and also very brief result or summary from our group discussion that conducted this morning. So I tried to check the question and answer box, but it seemed that there is there is no question yet for Prof. Fatma, but I believe that you will be still with us until the end of this webinar, right? So
yes, sure,
yes.
Yeah.
Okay, so by awaiting, maybe participants need more time to digest all the information that you provide, and then after listening another information from the second speaker, then the information is more rich, and then we can come up with a more complex or more holistic question and discussion. Yeah, again, thank you very much, Prof. Fatma. Yeah, and take care. I see that you are on driving and moving, still moving, yeah, mobile.
I'm not driving.
You're not driving. Okay,
I'm
so
sitting
take care.
at the back.
Yes, take care. Okay, yeah, again,
thank you so
very
much.
much.
Yeah.
Okay, so ladies and gentlemen, again, thank you very much for Professor Fatma Lestari. And now we come to the next, to the second speaker, which is Professor Dr. Engineering Eko Supriyanto, PhD. Please, they all see to, okay, yeah. Yeah, this is the profile of Prof. Eko. Wait, yeah. This is the profile of Prof. Eko, and then he is currently serving at the University Technology Malaysia and also International Teleconference Technology and Policy on COVID-19. So he is the representative of the UTM that has a collaboration work with University Indonesia, mentioned earlier by Dr. Agustin. We can see from his CV in here that he's very productive, international scope of researcher and speaker, have a lot of publication, article, wide network, and well-known among hospital technology and industry community. So, Professor Eko, are you already with us?
Yes, okay, Dr. Brian, can you hear my speech, my sound?
Yeah, very clear,
okay.
very clear.
Okay.
So yeah, without any further ado, please Professor Eko Supriyanto for 25 minutes presentation. It can be longer actually because from the 3 allocation time for 3 speakers is only 2 available right now. And again, for the participant, please don't be shy. Write down your question to the Q&A chat box so we can have a discussion upon your question. Time and screen are yours, Professor Eko, please.
Okay, yes, okay, thanks, okay, Dr. Brian, for the introductions. Yeah. So, okay, here I would like also to thanks for the committee, Prof. Agustin, Prof. Fatma, And I think I have also here Prof. Dr. Mondastri. Yeah, thanks. So, okay, and so welcome Dr. Imran also already here, yeah, and other guests that I cannot mention one by one. So let me share my screen, yeah, whether my screen already appears. Anyone? Dr. Brian, can you see my screen? Yeah. Okay, good. Yes, okay, thanks for the committee given me the title on regional or ASEAN perspective on the global health protocol, basically. My title, I adjusted a bit on the harmonizing is one of them, but also important is the extending, actually, because I think the COVID-19 pandemic almost, finished, and then we will next going to the endemic, which is, okay, the big question is whether, okay, this global health protocol for the COVID relevant or not. Yeah, this is, okay, the big question, basically. So currently I'm expert member G20 MOH, yeah, Ministry of Health Indonesia for Working Group 1, Harmonizing Global Health Protocol Standard. So 5 outline I will deliver today. One is, we need to check the current situation in Southeast Asia, whether the protocol that we propose still valid or not. Because, okay, I'm a researcher, I need to see, okay, the future, basically. And then second, if not, or if yes, still we have something that we need to maintain the sustainability, because during the COVID, yeah, there is the public health positive impact of the COVID-19. Okay, this is something that, okay, we need to sustain it. So then, okay, what are the opportunities? But still, okay, a lot of challenges that we need to handle. And what are the strategies that we would like also to manage? Current situation, challenge, because we know that we are not close to the endemic. This is, okay, so from these results, yeah. Okay, in ASEAN, yeah, in Southeast Asia, we have 4 wave, means 4 peak of the COVID-19. The first peak is around, okay, to 2020 in September, and then March 2021, and then back again in August 2021, and just few months back, okay, in somewhere in February is the 4th peak. If we see here, in the beginning, yeah, between the confirmed case and the death, considering look like the the ratio is higher, the death. It means we cannot handle, okay, at that time. But no, we see here, I think this is also impact of the vaccine, one of them. This is, okay, the confirmed cases lots, but, okay, the death rate is low. This is, okay, good. Then softly, okay, at the end, the death rate is lower, lower, and lower, even might be lower than, okay, normal influenza. The trend is a similar worldwide. Yeah, worldwide also have, okay, the at least 4 wave, but previously we have also some wave. It means if we calculate, and then just update for the vaccine conditions. Yeah, I just got this data from WHO. Maybe it's not really the up to date. Yeah, but this is I got, okay, like by end of last month, end of June. Indonesia for this case still, okay, 61.51 per 100 population vaccinated. Consider low. Okay, sorry for that. Compared with other ASEAN countries, yeah, except Myanmar. Yeah, hopefully, okay, government working hard to improve or to increase, okay, this number. The highest is Brunei Darussalam, 97. Yeah, congratulate for Brunei. And then the next one is Singapore. And then the next one is, okay, Vietnam, the Cambodia, and so on and so forth. So, but the booster, the highest one is the same with the Brunei, but Indonesia is still one of the lowest. Okay, just a little bit higher than, okay, Philippines. So this is the condition that, okay, we need to work, okay, very hard together in order to decrease the risk of the COVID-19 changes. I think everyone know what is the meaning of the harmonization of the global health standards. Yeah, it means, okay, we try to harmonize the use of the vaccine certificate. This is one of them. Indonesia having idea or proposal to recognize or to verify the vaccine certificate from at least G20 country, but I think in the beginning, ASEAN also. Okay, congratulations to us, the Minister of Health, that really success, okay, to have this. Yeah, hopefully in the next G20 meeting, all the leader come to Indonesia, show the vaccine certificate, and then we certify. I mean, okay, we recognize. But we see the situation currently. I just list here, except Brunei, because I cannot get data, okay, from Brunei, but the 9 okay, ASEAN country we have. For the COVID test, we see here, most of them is not required. Yeah, 1, 2, 3, 4, 5, and then okay, only for non-vaccinated is okay required. That's why the question whether COVID test is really need to be recognized or not, because yeah, I think most of the country, I mean more country, is not apply anymore for the COVID-19 test except for the certain cases. And then second, the quarantine, yeah, most of the country okay still applied for the unvaccinated. Okay, but okay, the not I mean some countries already not required any quarantines. Yeah, even for positive COVID, but they need to yeah, I don't know okay how they handle this. And then the next one is the vaccinations. If we see here, I think most of the country required vaccination proof to enter other country, except Vietnam. Yeah, I get this info from the website that not required to show the vaccines. It means if we okay recognize the vaccine certificate, Vietnam might be also not applicable in this case. Yeah. So, and then okay, we have also okay the verifications. I saw from the website that I get is only Malaysia that have vaccine certificate verification. Okay, correct me if I'm wrong. And then okay, the next one, digital apps. I think no. I mean the digital apps is okay, and the end is really not okay required. Okay, for the cross-border traveling, basically. Some countries still, yeah. For example, the Singapore, the ask okay the the traveler to fill up the SG arrival card, but Indonesia, because I just came from Malaysia yesterday to Indonesia, is just look okay to fill up the vaccine certificate, but it's not really okay checked. Yeah. So and then okay, Malaysia need to fill up the traveler card. Okay, this is something that also I see the important, because the traveler card we need to fill up many things, include the it look like simple electronic health record, include the signs, symptom, and so on. So interesting. Okay, that okay we need to see okay in this point. And then the next one, the face mask. Some countries not compulsory, some country advisable, some is okay, advisable or recommended indoor and also in the public. Temperature check is on arrival. Only Indonesia stated in the web, but I don't know, because when I was arrived yesterday, also not check the temperature. Maybe not this one anymore. So this is the current conditions. Okay, from here we see the challenges. Whether vaccination or recognition of the vaccine certificate is still required or not. It looks yes, because okay, most of the countries still need to have the vaccination proof. But the next, whether COVID test, whether required or not, this is something that you know things. And then digital apps, whether still required or not. Okay, this is something that we need to consider in the next development on the next harmonizing global health protocol. Okay, from here, I think we can like summary on the current situations. Okay, from the previous that I explained, one, the most country do not require COVID-19 test result. And then, okay, the next one, most country apply quarantine for unvaccinated, very clear. And then most countries require vaccination proof. And then most countries don't use anymore COVID-19 digital apps, okay, for many conditions. So I think this is okay, the current situation in Southeast Asia, at least. Yeah. The question, big question will be, is the recognition of the digital vaccine certificate still applicable? Second, is the recognition of the COVID-19 certificate still applicable? Because okay, no, we are working to this direction, but whether still applicable or not? This is okay the question. But okay, this is not means that okay, we don't need to continue our project. We need to continue, but okay, we need to think okay the sustainability after this. Something that is good to be used for the future to be applied. This is some lesson learned, yeah, on the COVID-19 public health positive impact. Yeah, I think everyone use the online meeting platform, including the telemedicine. This is very important. Yeah, so I think this positive thing, yeah, need to be continued. I think, and then the next one, the use of mobile apps for health risk tracking or tracing. So I think this is also something that is important. The use of masks, yeah, is also important. I think most of us still use it. And then the use of hand sanitizer, social distancing, and then we see also how the vaccine developed, how the mobile apps developed very fast. It's just few months or few days even. This is the fast innovation in the public health area, which never before. And then, okay, most of the country also implement the health system transformation, including also Indonesia. So this is some the very good impact that we need to sustain, okay, in this condition. But now how? Because in the momentum is gone, then yeah, gone. So only okay, there are some issues on this how to maintain the public health positive impact. The first issue, for example, the online meeting platform, including telemedicine. I'm worried. People already boring with this. People okay want to back to the old normal. Okay, physical human to human interactions. This is still something that we like miss it. And then second, the use of mobile apps for health risk tracking. So come with the issue of privacy, comfortability, and so on. This is issue that, yeah, from the point of view technology, we need to do something. The next one, the challenges. The use of masks is cost uncomfortable. This is also issue. I don't think if you okay, I mean outside very comfort to use this. Yeah, maybe if you meet someone, yes, but if not, then maybe you will not use anymore. The use of hand sanitizer costs, and then there are some report on the long-term side effect. Okay, this is also in terms of how the technology need to be improved. Social distancing is same with the okay number one is basically the physical human to human interaction already required this time. Comfortability also issue, and then the fast innovation in public health. Yeah, the problem is the innovation quality. If very fast, then the quality will be become something issue. And then the health system transformations, whether we want to continue because it's cost, time, and then yeah, readiness issue basically. So this is something that issue that we need to solve. So okay, in order to have this and the positive impact to be maintained, to sustain, we have some solutions. Okay, first for the online meeting, including telemedicine, yeah, it should be for the next is become the options of hybrid. We can do offline, we can have online. Yeah, I think hopefully this is become the trend for the future. We see how many percent. Okay, from the point of view industry, we need to think about this hybrid on the yeah online and offline. This is to save costs, time, and resources. But I don't know whether you are. I mean, you will agree that you just use the online meeting because then yeah you have problem with the traveling and so on. So I think this is okay first issue. But to sustain, yeah, become an options. And then second, to use the mobile apps for health risk tracking. This is also important, yeah, for public health especially. But we need to improve the benefit. What are the benefits of the vaccine? For example, vaccine certificates recognitions, because we know that the effectiveness vaccine is reduced. This is one, but we know also there is okay changes in our body that is really we have the immunity against okay COVID-19. And then second, the strategy is to ensure the data security, yeah, and also improve the user friendliness. So I think this is something that we need to improve. The use mask is becoming optional for the future. the use of hand sanitizer, need to increase the biocompatibility, decrease the price. Social distancing might be not required anymore. And then fast innovation in public health. So we need to adapt in new regulation to enable the fast innovation, because we have the experience. Why we cannot not? I mean, why we cannot do after the pandemic? We shall able to do. And then the health system transformations. We need to apply the right transformation management. During COVID, we are very rush everything. That's why the transformation might be not really right. We need to go back to the right method for the transformation management, including rearrange the vision, rearrange the resources, buying the people, and so on. So this is something that we need to consider become the solution to sustain the COVID-19 public health positive impact. The opportunities, from the previous, some regulations is there. I check here, regulation in telemedicine. Most of the country have, because of the COVID, one of them, but it's also previously already have it. Also, on the data privacy, they have also already. Here I check the Indonesia, Malaysia, Philippines, Singapore, Thailand, Vietnam, but I cannot check all. They have already basically both telemedicine and data privacy. We just need to apply. And then also the second is on the digital health. Indonesia having the Peduli Lindungi. This is from the government point of view. But in the private sectors, we have the Halodoc, for example. Same as with Malaysia, we have the doctor on call. We have MySejahtera. Philippines, we have the smart clinic, and then we have the COVID-19 tracker, COVID Kaya, for example. And Thailand, Vietnam, Singapore also having. So this is also the next opportunity. We have already this. We need to continue. We cannot stop. So because the resources that we spend during COVID is lots. Better to utilize. We need to think how we utilize this for the next time. The mobile apps from 10 countries that we have. Include Indonesia, Lindungi, Brunei Health, and so on. So and then other opportunities, the digital health platform. Singapore, we have MyDoc, Doctor Anywhere, SpeedDoc, White Code, and so on. Indonesia, we have Halodoc, and more than 20 apps. Malaysia have, Philippines, Thailand, Vietnam, and so on. And then another thing is on the current situations. This is I cannot get the newest data, but at least still 5 years valid. We have still lack of physicians per 1,000 people populations, especially Indonesia, Cambodia, Laos, Myanmar, Philippines, Thailand, and Vietnam. So this is why the telemedicine is important, one of them. And then second is the hospital bed. Still under the world average, even for Singapore, even for Brunei. This is the conditions. And then the next one, our opportunity is the market share. This is the prediction from McKinsey. Telemedicine having like 37% market size. The rest is including the digital pharmacy, chronic disease management, digital diagnosis, genomic, and wearable. So this is that we need to consider that, it's important, to have the continuation of this, because we have the market. I just took also from the previous webinar that written by Dr. Brian also. Thanks to the Brian for the Congress at the time, the webinar series 19. From the ASEAN perspective, at least from the 10 countries, with enough number of participants, 98% respondent agreed to declare signs, symptoms, and medical history. It means very good chance, to share the electronic health record. This is basically the basic one. Second, 64% respondent don't agree to share personal data. Why? Because the privacy issue and security issue. So it means, from the point of view in terms of technology, this is the basic become the foundation. We are not allowed to have sharing data as long as this issue not solved yet. So please not share the data if this issue not, because people will complain. 89%, it's a lot, will fail basically. So, and then 90% respondent agree to disclose the COVID-19 risk. means, yeah, disclosure of the data is no problem as long as privacy and security protected. And then 85% also agree to share data related to even not COVID only, preventable communicable diseases also possible. And then 83% agree to disclose electronic health record, which is more advanced for medical consultancy or telemedicine purposes. So this is the perspective in Southeast Asia. It's not only Indonesia, but also other 9 countries. So, and then, okay, I think that time we have some recommendations on translating the recommendation to for future cross-border ASEAN countries traveling guidelines, and then support and monitor vaccine certificate recognition. I think this is done very well from the Ministry of Health Indonesia. Yeah, and then the next one is test result recognition. But this is questions whether still applicable or not. The next one, study continue. It means it's good to have this study continue until we have bigger and higher impact. So, and then also possible to be applied in C20 countries after that. This is some recommendation that we have at the time. So if I can summarize the opportunities, first, we need to recognize COVID-19 vaccine certificate is done already, yeah, and this is very good for the entry point. This is must. And then an option to recognize also another purpose, COVID-19 test certificate, basically, but for special purposes. And then also this is that it should be shown to recognize the health declaration for cross-border traveling. So they can use any mobile apps that every country have, but we need to recognize. It means we need to standardize which data that we need to share and so on. There must be discussion on that. Okay, I think it was also Prof. Fatma already mentioned on what are the data that people want to share and so on. For example, PMI might be not, and then and the COVID history not. But we need to further explore. Doing some more survey on that. Then also opportunity on the recognition of the electronic health record, because this is important if we are traveling from one country to other country, yeah, and then we have, for example, accident or we are sick in other country, then it's very good if we are able to recognize the electronic health record, so that no need to have second diagnosis, second measurement of the health data, basically. The challenges. The problem first is the urgency. COVID-19 pandemic ended soon. Second, some privacy and security issue. Third one, resources. No, we have, a lot of country in the financial recession. This is what we need to consider. And then leadership, strong and transformative leadership. Leader that always not tiring to transform the organizations. This is really required. And then people acceptance. So the cost benefit need to be improved. What are the benefits for the people? Yeah, it's not only about the regulation, but it's really people got the benefit. Then this is something that people will accept. And then sustainability. So no, I didn't see any very good roadmap. So roadmap need to be created if we want to go this, so that we able to secure the sustainability for the future. So for this, we need to have a strategy. Yes, cost benefit analysis we really need to do if we want to continue this. Plan for sustainability, including the establishment of roadmap and regulations. After that, the team, not only one single team, is consortium of stakeholders is important. And then the implementation always, and then we need to monitor and evaluate. So this strategy. Oh, it's my last presentation, slide. As a conclusion, first, actually, in Southeast Asia, there is a need to strengthening the use of the digital health, especially for telemedicine and personal health record, because there is agreement, there is regulations, there is example technology already in place. So we just need to top up with something a little bit on the agreement, mutual agreement or recognition of this technology. Then actually be able to implement this, and this to enable, for example, the health tourism. Yeah, If Singaporean people want to go Indonesia, okay, we can share the personal health record from Singapore to Indonesia. Same also from Indonesia, if we want to go to Myanmar, for example, for the health tourism there, is also possible. So personal health record, we need to have agreement on that. And also, okay, for the telemedicines to enable, because we are still lacking medical doctors and so on. Why not? Yeah, this is okay first. Second, the recognition of digital vaccine certificate is very important in Southeast Asia. And this can become the entry point for the implementation of the broader digital health. So we need to do, must. And then the next one is there is a need to maintain the positive impact. Yeah, the positive impact we need to maintain COVID-19 pandemic through ASEAN health transformations. Hopefully we have, including the harmonizing personal health record and recognizing ASEAN telemedicine. Thank you, and then see you in the next ITT webinar, which will focus on the ASEAN requirement on electronic health record sharing. We see, okay, what are the requirements to share? Okay, this is will be conducted on 28 July 2022 from 2 to 4 Malaysian time. Thank you very much, one more, and I hands over my time to moderator. Thanks, Prof. Dr. Brian.
Yes, thank you very much, Prof. Eko. There are so many new things from your presentation, and because like you mentioned, you introduced to us that you are part of the the Minister of Health of Indonesia, part of the G20, preparation for the G20. So I think it is all the information is very valuable for us, and then there are. I see that you give a conclusion that also in line with our initial result or our discussion, that, for example, there are some lessons. Every country has a lesson learned from the pandemic, how we respond, and then we can learn from that. And then also we noticed that a lot of publication also, Dr. Prof. Eko, publication, so it can be an evidence, because we know that during the pandemic we just do the trial and error, but now we have evidence on that. And then the pandemic also has somehow, you mentioned during your presentation, that has accelerated some of process that before is need very long time, but now somehow it can be very accelerated. For example, the vaccine development, and then we move very fast to the digital life, yeah. And telemedicine, it's not only for the pandemic, but potential in the future, it can be part of our life. So again, thank you very much. I see in here, I check Prof. Eko from the question and answer box, but again, there is no answer, there is no question yet from the participant, but we still have time actually until 3 p.m. Indonesia time, Western Indonesian time. So we still can have a discussion.
Dr. Brian?
Yes.
Sorry, I think there is questions from Professor Medi Kurnia Wijaya. Actually, this is my best colleague.
Is it in the question? Oh, okay, so it's just coming. Yeah, it's just coming. Okay, so I read the question in here. The harmonization idea is excellent. This is from Ibu or Bapak? Ibu, ya. Meli Kurnia. Prof. Meli Kurnia Wijaya. Prof. Meli Kurnia Wijaya. So she said that the harmonization idea is excellent. Although COVID-19 seems will come to an end and transform to endemic, our effort and lesson learned can be used to upcoming other pandemic. What do you think? So I think this can be responded by both speaker, Prof. Fatma, and also from Prof. Eko. Prof. Fatma first, maybe lady first.
Thank you so much, Dr. Brian. Yes, hopefully pandemic COVID-19 come to an end and transform to endemic. Hopefully the Omicron BA .4 and .5 would not causing significant or pandemic again, yeah. But we still think that lesson learned, I think the best way that we could get is from the lessons learned, and many lessons learned, including based on our in the morning focus group discussion that Indonesia or maybe other countries, G20 countries, are having their own local knowledge, local or traditional cultures, which can be adopted for anticipating future potential pandemic. In Indonesia, as we know that plenty of best practice are coming from local knowledge. And we are now moving also from risk management to resilience. Actually, pandemic COVID-19 has given us the effort or the willingness to be more resilient. I think that's all, Dr. Brian. Thank you.
Thank you, Prof. Fatma. Prof. Eko, you want to add more?
Yeah, I think you're right. Okay, Prof. Meli, that COVID-19 pandemic will end, yeah, and then become the pandemic and will end and then become the endemic. So we don't need to wait until the upcoming other pandemics. We need to utilize it to continue, I think, for at least public health purpose. After this, I think the public health need to take over all the result from the COVID pandemics, become the tool, for the research and so on. You need to continue, I think, because this tool is very important. So including the mobile apps. If we do not use anymore by government, at least the Faculty of Public Health, University of Indonesia use it. So I think this is very important. So this is one. And then second, also as I mentioned, we extend. It's not only for the COVID, yeah, but we need to extend to other electronic health record. It means can be used directly to the patient basically. I think and then automatically for the future also we will ready, not like last time we are not ready. Yeah, we don't have the isolation room, we don't have the ventilators enough and so on. So because of this we need to prepare well in terms of the room design for the hospital, in terms of the digital apps that we need to have. So I think we need to utilize it, yeah, so that even whether the next pandemic coming or not, we are ready. So this might be just my personal point of view.
Yes, thank you. Yes, thank you, Prof. Eko. Yeah. Thank you, Prof. Eko. Yeah, just this is in line with your conclusion, yeah, because the changing is already happened, and then we have a lesson learned. So we cannot just throw everything that we already built during the pandemic, but we can take some of the lesson learned from that and then continue the changing, because the next pandemic is not something that in our dream, but something that probably is already in our already in front of us. We for example, Prof. Fatma also mentioned in her presentation that for the unidentified hepatitis, and then the monkeypox, even though global Indonesian and global and many other countries in global also has a very good response for these diseases. But yeah, again, we don't know in the future. And I think this is also in line with our vision and mission for the G20 to build the global health infrastructure, global health structure. And then Prof. Eko also mentioned that not only Indonesia, many countries also do the transform, not only health system reformation, but also the transformation health system transformation. Yeah. Okay, so actually now our time is up. We already spent more than almost 3 p.m. But yeah, we still have 15 minutes. But I will check again. Sorry, I will check again if there is another question in the question and answer. No, it's only one question. So I can open again if there is a question. If not, then we can continue to the next session. Or maybe Prof. Fatma or other panelists in here want to directly request for question to our excellent, our great speaker here, Prof. Fatma, and also Prof. Eko. Tidak ada. Yeah, okay, so before I end this session, Prof. Fatma, do you have a closing statement from this session? And also Prof. Eko, maybe 1 minute or 2 minute closing statement? From Prof. Eko first, maybe?
Yeah, I think, okay, first, we need to support what, okay, Ministry of Health Indonesia already did, yeah, to harmonize or to recognize the digital vaccine certificate. This is, okay, first. But we need to also work together, and then we need to plan, yeah, in order really, okay, to implement the, okay, broader specification of the digital health. So we need to work basically. Thanks, Davia.
Yes, thank you, Prof. Fatma.
Yeah, thank you very much, Dr. Bian, Prof. Eko. Yeah, I think now lesson learned from pandemic COVID-19 has taught us many things, including the implementation of public health measures, and our science from public health research come to an implementation and in real life, which are also increasing public health personal hygiene, as Professor Eko also mentioned, that we are now more aware to the importance of using of mask, social distancing, mobility restrictions, as well as also the personal hygiene. Yeah. Thank you so much, Dr. Brian.
Yes, thank you, Prof. Fatma Lestari and also Prof. Eko Supriyanto. Ladies and gentlemen, we have an interesting session recently discussed about the harmonizing global health protocol standard between opportunity and challenges, and then the spirit to continue the changing the good change that we already have. And Prof. Eko also share about the analysis, the situation analysis in the Southeast Asia, but our challenges actually is to see how this will work in the G20 countries. And then, as mentioned by Prof. Fatma, the survey is still running. So hopefully we can also get more information, insight, and then voices. The most important is voices from the civil society, from the G20 state country member. The fact that G20 countries have accepted the health protocol standards, we know that, but it doesn't mean that harmonizing global health protocol is easily implemented. We are aware if there are still gaps, for example, on the acceptance of testing type, duration, vaccine type, doses, whether complete doses are sufficient enough for certain period, or whether booster are still needed when people is traveling across country, whether test result and vaccine certificate recognition is accepted by all member states of G20 countries, whether sharing data is being concerned, and how to apply and mitigate the risk. Some concern will be articulated in the next session, which will be moderated by my colleague, Pak Henry. Lastly, we're also aware that using the technology of information and artificial intelligence are close to the mass tool very soon. Indeed, already applied. While potential pandemic beyond COVID is also threatening us, we heard about unidentified hepatitis, monkeypox, animal disease that probably can also be mutated to infect human, etc. Ladies and gentlemen, that is all from me as a moderator. Thank you very much for staying with me in this session. And I'm giving back the screen and time to Mr. Abdul Kadir. I almost want to say adding
It's okay.
to the master ceremony.
Okay, thank you very much, Dr. Brian and all the speaker, Professor Fatma and Professor Eko. Thank you for great experience and sharing related to G20 and COVID-19. And I will remind you all the participants to don't forget to fulfill the attendance list, and certificate can be downloaded tomorrow on our website, as well as the material for today's webinar. For the next session, which is session 2, will be a session of panel discussion that will be guided by the new moderator, Dr. Handi Erwijaya. And before it, I would like to introduce about Mr. Handi. He graduated from biomedical engineering from the University Technology Malaysia, and for the master degree in Institute Technology of Bandung in similar subject. And for the undergraduate degree, he graduated from ITB as well in electrical engineering. Now she is a lecturer at Public Health Faculty, Universitas Indonesia since 2017, and also as researcher at Health Informatics Research Cluster, or HIRC. And the last is as activist at Indonesian Artificial Intelligence Social, or IAIS. Without further ado, I would like to invite Dr. Handi to lead the next session. Thank you very much.
Okay, thank you, Mr. Ading. Sorry, Mr. Abdul Kadir, to allow me. Good afternoon, everyone. I'm the moderator and welcome all of you to this session. Today's webinar is about harmonization and strengthening a global health standards and recognition protocol COVID-19 from any perspective. Ministry of Health, academician, and also civil society representative G20 countries. Has come from Ministry of Health is Dr. Imran Pambudi, MPHM, and also from academician is Professor Dr. Hasbullah Trabrani, MPhD, Dr. PH, and also from civil society representative G20 countries is Dr. Anthony P. Sunjaya as MPhD candidate. Okay, ladies and gentlemen, the first speaker is Dr. Imran Pambudi. He's already now. Okay, this is the CV from Dr. Pambudi. I will read the CV of the first speaker on the screen. Education from Faculty of Medicine Airlangga University, Surabaya, and ASEAN Institute of Health Development Program, Mahidol University for the master. His experience is Deputy Director of Health Quarantine, MOH, from July 2021 until now. Before, he has assignment duty National TB Program Manager, MOH2, Deputy Director of Multilateral Health Cooperation Department, MOH2, from 2016. And also Maternal Health Program Officer, MOH2, 2012 until 2016. Okay, before the presentation begins, let me inform you how the presentation will be going on. First, Dr. Imran Pambudi will be invited to present the material for 50 minutes. And after that, there will be a Q&A section in 5 minutes. Okay, now allow me to welcome the speaker, Dr. Imran Pambudi, to deliver presentation. Dr. Imran Pambudi, the floor is yours.
Yeah, thank you.
Yeah, please.
Yeah, can you hear my voice clear?
Yes, of course.
Yeah.
Yeah.
Okay.
Your voice is clear.
Yeah, thank you. So finally for your time for me to explain about how G20 pilot project, especially for the universal verifier as a result of the the first health working group of G20 in Indonesia. So yeah, allow me to present this slide because and maybe after the discussion or during the discussion, since this is technical things about universal verifier and digital technology, so maybe after this the discussion, my colleague from the digital transformation office from Ministry of Health also helped me to answer this one. So next, please. So this is the challenges. Yeah, maybe you know what is the challenges during the COVID-19 pandemic. So first, the Omicron has expanded to 150 out of a total 195 countries in the world. So it means that almost 80% of the countries are infected for the COVID pandemic. And also the UN WTO also reported that international tourism arrivals from year 2020 and 2021 were respectively 70% and 72% below the observed in 2019. So those problems affecting many sectors, including trade, tourism, education, and so that will impact the economy. So this condition needs for the mutual recognition of digital COVID-19 certificate in G20 countries. Why? It's because of nowadays, maybe all of the countries, they ask every international travelers when they enter their country to show the COVID-19 vaccine certificate. So, what is the background of the need of the recognition of documents related to COVID-19 for G20 countries? The first is COVID-19 test and vaccine certificate required for travel documents across borders. Even though nowadays only very few countries that require a COVID-19 test, but almost all of countries still need vaccine certificate requirement. And the second is in 2021, the G20 leaders committed to restart international travel in a safe and orderly manner. Thus, countries have different implementation of WHO digital COVID-19 certificate guidelines. So, in the early pandemic, WHO started to develop the guideline of WHO digital COVID-19 certificate. However, even though the guideline is already established for this one, however, for the implementation, still many variations of this guideline. The other background is every country have different verification mechanism for digital COVID-19 certificate. Even though they have or we have the digital certificate with the QR code or the barcode, but still how to verify is different. So it means that the digital certificate that already printed or developed in each country is not universally recognized because they need formal agreement among countries. Next, please. So after the first head working group, And the result of the first health working group is one of the results is uh, we will have or we will proceed the pilot project about the universal verifier of digital certificate of COVID-19. So the vision, we have two vision is to follow safe international travel through establishment of global digital health trust network and federated public trust directory. I will explain what is the federated public trust directory. And the second vision is to foster successful digital transformation in health documentation protocol and to inform international health regulation amendment. So about the IHR, now we are in the process of the amendment of IHR 2005. And the process is start after the decision during the last WHA or World Health Assembly in June. So for the pilot project, we have three missions. First is establishment federated public trust territory to harmonize multiple existing platforms and process to the trust network. And second, the pragmatic ways to facilitate global mobility through collaboration with international organizations such as WHO, OECD, and CDHP. So for the pilot project, G20 countries and Indonesia will be supported by WHO, OECD, and also CDHP. Since this initial, the project is also to possible to endorse the implementation of WHO COVID-19 certificate guidelines. And the last mission is the trust network on G20 countries piloting on federated public trust territory. Next, please. So what is the value of the pilot project for G20? First, the establishment of federated mechanism between existing trust networks. The second, we endorse leaders mutual recognition endorsement and federated public key directory for mutual recognition of COVID-19 vaccine certificate among G20 countries. Because we assume if the G20 countries have the mutual recognition, so it's strong enough to start like snowball to other countries to use the federated public key directory for mutual recognition. And the last is advocating on digital health documents for inclusion in IHR amendment. So what I mentioned before that in IHR amendment, the one point that we will endorse is to put the digital health documentation. Okay. Slide, please. So this is the timeline or scope of pilot project. So from May to June 2022, we try to establish a virtual test of the federated public trust directory, and we have the 3 milestones. And during May to June 2022, we also have the integration of various trust networks with the federated public trust directory, because there is some several types of trust network. So we will try to communicate among these trust networks. And from the June until July 2022, we are entering the first stage of the virtual connection and ministerial endorsement. Ministerial endorsement. So we have several milestones for this stage. The first milestone is about the successful testing integration. The second is about the successful testing in G20 members or pilot countries. And the last, in July, we hope that we have ministerial endorsement to continue the pilot project. And during the first health minister meeting in Jogja, the endorsement, we got that endorsement. And the last stage is the Connect hackathon, and also implementation will be held on in August until October 2022. So the milestone is we want to resolve all of the challenges and obstacles found during the previous stage, because in the piloting during piloting we can get the several challenges, several maybe bugs. So we will fix all these things. And the second, we will have the agreement for implementation of global or federated public trust directory. And the third, of course, we hope that we have a successful rollout of the pilot. Next, please. So this is the federated architecture. So maybe this is in the left-hand side. It's like the federated public trust directory is like one single what we call pattern that can unify or semi-autonomous application or network or software system, and each system operates semi-autonomously. So it can scale, it can process, experiment, and also implement different technology. And each trust network gateway will pull the connection to the federated public trust directory. And also the public trust directory will also download data from multiple trust network gateways and also append it to its own. So it's very technical. Maybe later on, my colleague from Digital Technology Office can explain more detail for this one. Next, please. Next, please. Yeah. This is another what we call the how we can describe about federated public trust directory. So as G20 countries have different trust networks like IATA, ICAO, EU Green Certificate, and also Common Trust Network. And for federated public trust directory, we can different trust network will be harmonized to verify vaccine certificate or health document, which will be facilitated by WHO. And we will use the verifier app based on federated public trust directory. We use as a federated public trust directory for apps to verify vaccine certificate or health document. It's ready to verify all QR codes and digital health documents for safe travel. So it means that these apps can read not only certificate, but in the future, maybe we can also use this one to what we call to scan for the another data for this one. Next, please. So this is an example of G20 Universal Verifier. So in the left-hand side, this is what we call the international certificate of our COVID vaccine. Yeah. You can also download it in Peduli Lindungi, and it's very simple. Yeah, for downloading it. And just now, yeah, I am in Singapore, and it's very easy to use. And when I show this certificate, so the system in Singapore can be read for this one. Next, please. So this is an example use case of recognition protocol of implementation. The first is people from G20 countries arrive in other G20 countries and own their international QR vaccine certificate on apps or paper-based format, right? What I mentioned, but what I told you that now when I depart from Jakarta, I try to download the international certificate from the Peduli with the WHO what we call format. So it's what we call this format is ready to scan or to use in another country. So when we arrive, so the immigration or health officer will verify passenger QR certificate using G20 Universal Verifier. And COVID-19 certificate will be verified, and voila, G20 citizens will enter the other G20 countries with not many what we call a seamless process like that one. And this simulation we already done during the first health minister meeting in Jogja, and Dr. Tedros, the DG of WHO, admit that it's very simple and say that it should be proceed to another country or extend to another country. Next, please.
Thank you, and have a nice day.
Yeah, so this is the feasibility of the expansion of how we can use this universal verifier. First, we can establish trust of digital science clinical algorithm published by WHO through the SMART guidelines work. The second, we also allow for a global product catalog of trust medical product and device, and also ensure information about a patient can be accessed and trust regardless of where you are in the world. And also, this system can also support health system resiliency to address future outbreaks in globalized economy. Yeah, I think this is important because also during the conference of global health security conference in Singapore, we are talking a lot about how we should prepare for the next pandemic, and also many many forums that mention about how we can strengthen the digital technology about this one. And after that, we also empower individuals to manage their own health and well-being enabled by a personal digital record using IPS. And the last, it also prevents the digital divide from the increasing if WHO is not at the table. And inequity would only increase as we have already seen. Next. I think that's all, Pak Andy, for my presentation, and back to you. Thank you.
Okay then. Thank you, Dr. Imran. Okay. Dr. Imran, could you stay in this room after this section end? If yes, maybe Q&A will be after all presentation present. How about that?
Yeah,
Dr.
yeah,
Imran?
okay.
It's
Yeah,
okay, yeah? Okay. Okay, then. So maybe I would like to invite Professor Hasbullah Tabrani. Are you here? Hello?
Yes, I'm here.
Oh, okay. Okay, then.
Ya,
Okay, then.
terima kasih to Mbak Brian just sending the jempol, Mas Hendy. Okay. Shall I share my screen? Do I
Yeah, of
have
course.
the license to do it?
Okay, Mr.
Yes, Prof.
Yeah,
Can
okay.
have, yes.
Yeah,
Thank you.
thank you.
Yeah, you're welcome, Prof.
Thank you very much. I'm sorry I wrote my presentation in Bahasa Indonesia. I was not well informed, so I didn't also cross check. So because I received invitation in Bahasa Indonesia, then I thought it will be in Bahasa. Yeah. By the way, selamat ulang tahun. Happy anniversary for FKM UI. How old is FKM UI now? Quite old, yeah. So I'm asked to talk about this harmonization and protocol recognition, but perspective of academician. So I was thinking what to talk about this academician on this protocol recognition and global standard, because I think I was expecting already that other people already talking about this protocol standard exchange. Then I will focus on how the academician should think this COVID as a part of a challenge to find the wait, how do I change why it's not moving or the okay, thank you. So the academician should find the truth among various of data and fact evidence to use the truth to improve the welfare, the better life for human being. So that's the academician, right? Now, do we have that lesson from this COVID-19, and how do we share, and what are needed to academician to study, to see, and to create a hypothesis, because academicians should work with hypothesis. Yeah. First, let's see. The World Bank report just early this year showing that first lesson from this COVID is that it is impact. It's much bigger than previous disaster, World War II even, and global financial crisis. That because more than 90% of countries were affected or are affected by this. Yeah, and the loss in terms of economic about 3% of GDP. That's about $3 trillion. It's very big, yeah, and more than 100 million people went to poverty. So this disease awakened our health reform all over the world, and especially for us in public health. Now all of a sudden the door is open that public health is not only a small thing that too expensive to pay attention, because in the past most of countries, low in the middle income countries, did not pay adequate attention for public health or for communicable disease. And all of a sudden, the COVID show us that this communicable disease can create huge loss, economic loss to the world. This disease, starting in the middle income countries, have big impact on the high income countries, and therefore there should be joint work together. There should be a collaborative work across countries to ensure that this can be tackled. So let's see the current profile. I think the session before from Malaysia already, from ECO already also showing similar cases. This is what happening. This is Indonesia. That the figure, although in different scale, yeah. This is in India. It's about the same pattern. In the world like this, no, not very clear to mode. Actually, they are separate modes, but because of the very high cases in the US, so we can see the world figures closely related to high prevalence in certain high income countries, like the US. Yeah, from the graph we can see the pattern. So what's happening with that is that disease, the COVID, like more people in the high income countries because there are more money there. We don't know. Yeah, that's another economic and academic exercise for this. Let's see the data also in some ASEAN countries. Iko already mentioning. You can see the patterns very different from Indonesia and Vietnam. Vietnam initially could control very low cases, and all of a sudden, scoop. Now the number of cases, reported cases in Vietnam, much higher than Indonesia. It's reached 8 million. Indonesia 6 million. So, what is the condition with that? Similarly with Thailand, while Indonesia having slow progress and so on. So what's happening with this is that PROCAS, the protocol for health control, is immunization. What are the impact, the factor that create the differences of this, or maybe the sensitivity of population? Because this term, what we are discussing is the global perspective. Yeah, so we can see in the global perspective why there is a difference across different countries. How about the income countries? This graph showing us that I just took 5 countries with more than 200 million people. Often we discuss, we argue that we are a country with the big countries, difficult, and therefore we are not so successful and so on. Let's see what's happening with that. These 5 countries or 6 countries, sorry, with more than 200 million people. Why in China the case so low that they could control, while in Indonesia, India, it's about the same rate, yeah, per capita, because this is cases per million people, yeah. And why Pakistan getting less? And why the United States get more cases, and Brazil, and also in the mortality, the similar pattern, like positively correlate with high income countries. Why this mortality? It is per million, yeah. Remember that this is not the number of cases per million, so we already adjusted per million. something something unique here that we have to find out as academician what's wrong with that, and what the impact for us if we don't have if we don't share the data, if we stop or we stop wearing masks now, as in the US or the UK, they already stopped. What will be the impact to the US to us because of the travel and so on? So that's kind of question raised from this just data. And then we look at this biweekly confirmed cases per million people, not daily. So it is bi-weekly 14 days moving average. India and Indonesia have a similar pattern. Is that because of the traveler of those countries? The US has very high cases during this Omicron. This is during the Delta. And during the Omicron, we can see the peak in those five countries, because the China basically is outside from this observation because too low. So what's happening with that? Why China remain low? No, not significant increase. We know that China have a very strong control. Is that a lesson for other countries, that if we don't expect, if there is another pandemic, both in human or animal, like currently in Indonesia we are having PMK, it can be also a pandemic across all countries. Why is that? Well, what are the factors that creating this pattern? Yeah, is that travel or is that vaccination? If we look at the vaccination, are those vaccination effective to control disease and to control death of this? We can see this is data until the latest last week or early this week of the booster administered. Yeah, this is million of people. We know the US has 300 million people, so that's about 40% already covered, and Brazil, but Indonesia, India relatively less. But if we look at the death per million, maybe we need to have lag times. Yeah, how many months lag time? Even if we do have lag time, we can see there is something not very clear correlation if this vaccination booster correlate with the reduction of the death. We can see apparently yes. Yeah, but how and why in the developed countries still have higher mortality? We can look also in this global what's happening of this disease distribution. This is the case, yeah, by region. You can see the largest cases are in Europe. What's happening with Europe? Why European people get higher risk and smaller death? Is that because of the quality of care or because of something else? China certainly not seen here. ASEAN also relatively good. What happening in South America? Yeah, that's a lot of hypotheses can be developed globally to then develop some policy that contribute to the global. Remember that the risk of the spread of disease across the world much higher now. If we can compare, for example, during Spanish flu in 1918 to 1922, at that time the travel time from London to New York took 3.5 days because at that time airplanes not available, and the number of people traveling only is around 10,000. But nowadays, the travel time is only 8 hours, so 11 times faster, and the number of travelers reaching around 25 million a month. This is from UK to USA. You can imagine across the world how many billion people travel, and therefore, because this disease human to human spread or contact, then the risk of having similar disease at the same time, if we can see the graph before, at the same time, because of traveler will be huge risk. Yeah. So what if we don't have good vaccine, or our vaccine will not effective again after 1 year or 2 years, and this disease mutates again to be a more deadly virus? We don't know. Yeah, hopefully no, but if that's happening, what can we do? So this kind of question hypothesis that need to be developed. So we have to prevent the similar disaster for the future of our cases. Now we are in this arena here. Economically is okay, good. We have a severe cases almost 2 years ago. Now we recovered. But the problem is, if we look at the vaccination, this is from the World Bank and WHO report early this year. In the high income country, advanced economies, vaccination very good. Middle income countries still okay, about 50%. But in low income countries, the vaccination very low. What's happening if then the virus, as we observed the Omicron coming from South Africa, middle income countries, yeah, but then spread all over the world very quickly because of the travel. So what can we expect from the current situation? Is it a pattern that virus can transform? That's a question. Well, we talk about this sharing data thanks to this technology, not only information technology that we want to share, but the current advanced technology and biology. We can identify the agents, the virus SARS-CoV-2 very quickly within months. 100 years ago, we didn't know, and therefore Spanish flu took 1/3 of the world population die, but now not anymore. The advantage of epidemiological studies, we can predict how this human-to-human transfer of this disease can spread, and then we can predict, although maybe not very precise, but we already demonstrate a good result for this. So epidemiological science now becoming a booming interest. That's part of the advantage of this COVID for public health program. The information certainly is very quickly spread all over the world. The diagnostics, this is a little bit late, but it is also putting the risk for all of the middle income countries, because the availability of gene sequencing to detect new variants, and also to detect disease varying across countries. But because of the travel time very short and more people are traveling across different countries, different continent, the risk would be very high. What about new vaccine? We don't know. Our Indonesia, for example, vaksin merah putih still not ready yet. Is that ready for the booster? Is it improved? There's still a lot of challenge academically. to prevent from re-emerging of this disease? Hopefully no, but it is possible. Yeah, so vaccination. The main problem is the human reaction of this COVID. We do have application, mobile application. It's quite effective to control people behaviors. Yeah, but what about the similar application in other countries? Yeah, how about the reaction of the official in some countries? I discussed with colleagues that just returned from Africa. It is a big concern that no big movement to prevent. Yeah, well, hopefully they have some resistance. Yeah, reaction of the business people, that they are forced to do something because they are not able to sustain of the market failure in their situation. Although there are a big movement in the internet or apa namanya, belanja online. Yeah, so there are many hypotheses that academician can develop for the public health program based on this COVID, and that might be also another disease, another communicable disease. But don't forget also the non-communicable disease can be neglected because of the too much attention for the COVID and communicable disease. Yeah, there are differences of the data. They can be under or over-reported. We don't know. I spoke with my colleague from the US. Why? I said the US has so many cases. He said certainly that's incentivized by the system, because the government pay $13,000 per case of COVID. So many healthcare facilities making COVID for the disease because for the financial incentive. So if we do that, can we use the data to control or to prevent? We don't know. That's a lot of unknown on this. Yeah.
2 minutes.
Yes. Okay. Yes. Similarly, Indonesia, we in the past we have a lot of incentive for COVID because the high reimbursement. Now we control with much lower. So remember also, as I mentioned, for the non-communicable disease, it can be also another disaster for us. So the challenge, how we use this technology to ensure that we have good data, yeah, accurate data, valid data, and timely data to share. We have this advantage. The technology is there, but human response is the biggest challenge for us in developing countries. And in addition to that, the externality of the policy development, it can be a big challenge for us. The infrastructure of the healthcare system must be changed. Early warning system must be developed. Intersectoral health, integral healthy planet movement, One Health, fairness in the diagnosis, in the vaccination, funding, and others. The ministerial meeting last 2 weeks ago in Jogja already agreed to establish financial intermediary funds, but there are still a lot of challenges of fairness of the use of the fund and contribution. So there are a lot of hypotheses that academician can do. Maybe many doctoral level can be produced by UI, by other university, Indonesia, Malaysia, and others join together. I think they will be coming the truth, but may not come at the time that we want to see. We still in the early stage to understand the overall of the COVID and how to prepare not to have the similar pandemic very soon. Thank you. Sorry for a little bit late. Thank you. Back
It's
to
okay.
moderator Henry. Thank you.
Okay, thank you, Prof. Hasbullah. I apologize in advance. I will tell you a little bit about Professor Hasbullah before we move on to the speaker. Sorry in advance because last time I tried to ask the professor and then directly Prof take the part for the presentation. It's okay, Prof?
Sorry.
Yeah, it's okay. Thank you, Prof. Yeah, I will tell you about Prof. Hasbullah. Prof. Hasbullah Tarbani was a professor and former dean of the School of Public Health and former chairman of the Center for Health Economic and Policy Studies, Universitas Indonesia. He is now serving as a senior policy advisor on strategy processing on family planning. Okay, and planning and maternal and child health with Think Well, funded by Melissa and Gates Foundation. Okay, maybe this is the little bit about the Professor Hasbullah. Thank you.
Thank you, Henry. Enough. Yeah.
Okay. Thank you, Prof. Okay, let's move on to the third speaker. Okay, can you show the CV, admin, please? Okay, the third speaker is Dr. Anthony P. Sunjaya, SM PhD candidate. This is the CV. He graduated from UNSW, scientific PhD. This is scientific PhD medicine for candidate, yeah, Dr. Anthony. He graduated from University Tarumanegara. Also, two, yeah. You have two doctor. Also, he graduated from Harvard's Medical School Foundation of Clinical Research Certified Program Decision Science Elective. His experience is visiting researcher, Imperial College London, Royal Brampton, and Harefield Hospital. Oh, so many. So maybe
that's enough. I think I can start.
Yeah, yeah. I will invite you to become next speakers, and your time is 20 minutes. After that, then we have a question and answer section. Please, the floor is yours.
Thank you, Hendy, and speakers. Also, Prof. Atma, Mas Yudi, and others from the committee for having me today on behalf of PPI Dunia. Share my screen. Can you see my screen?
Yeah, of course, please.
Thank you. So today I'm here to speak regarding harmonization of global health standards, but from a civil society perspective, and I'm requested to share what's happening actually on the ground with regards to internal mobility, but also international travel. First of all, I'll just give an introduction to civil society, I would say, organization I'm representing, which is PPI Dunia. So we started a long time ago, over 100 years, if we were thinking about referring it to the Indonesian society in Leiden, in the Netherlands. Importantly, though, we are present in 18 of the 20 G20 members. And I'll be sharing tips I've received from members who are studying there, but also from some other desk reviews. Before I go there, I would just like to have us think what's the current state of COVID-19 actually globally. And I'll play this 50-second video for you to hear. as you can see from the video, COVID-19 certainly has not ended per se. It's still rising in a few countries, many of which are in G20, as shown there, which is US, China, France, Italy, and others. Whereas, fortunately, I would say in Indonesia, we've done quite well, or really well, compared to the other countries in G20. Yesterday, we've got an extra 2,000 cases, but at the same time as well, only 616 is active. And with some increase in those vaccinated first, second, and having their booster jabs. So overall, I think for Indonesia, it's quite a rosy perspective. And I'm here to talk a bit more regarding orders. From what we've seen in the various countries in the G20, the public health orders are very important. They cover things relating to what to do when you're indoors, when you're outdoors, when you're asymptomatic but positive, when you have close contact, for those with symptoms, but also importantly with regards to international travel, internal mobility, vaccination, their certificates, and digital health tracking. I'll be mostly focused on internal mobility and international in each of these countries. I'll provide a brief of a snapshot, then afterwards some thoughts regarding what might be needed, what should we think as well, including with the collateral damage from COVID-19 and potential ways forward. First of all, internal mobility control. In Argentina, for example, most restrictions have been lifted, as you can see here, but they can be established anytime. And I think this is one problem sometimes with COVID-19. We see that things change rapidly without clear cutoffs up front, and that this brings instability as things go. Whereas in Australia, where I'm based at UNSW Sydney, no movement controls, masking recommended but not mandated, despite the large number and increasing number of cases, not only of COVID-19, but also influenza. And that the use of check-ins like Peduli Lindungi here is no longer mandatory. In Brazil, it remains a serious health risk, but again, restrictions are not really in place. Whereas in Canada, you would require fully vaccinated proof of to travel around the country. In China, I think as we're aware, there's recent outbreaks in Shanghai, Beijing. A lot of our colleagues are there as well in the cities and others in China. And this has resulted in mass testing of everyone, we would say, in the city. Residential lockdowns, closures of school, businesses, and suspension of public transport. Some might be aware that people have been sleeping in offices and in businesses when they're under lockdown, just for things to get going. And I think this is a big problem with regards to mental health as well. Ongoing responses, including those mandatory testing and also quarantine in designated medical facilities. So they are still very much, if we were to consider, a lot, or I would say not much different compared to what has happened in 2020 when things started in Wuhan. And the Chinese health app will change from green to yellow. So this really is your pass when you move around. If it's not green, you cannot move until you have complied with testing requirements and receive negative results. In France, things have eased. Mask wearing and presenting health pass, as used to be the case last year, are not really required, except in very limited circumstances, such as visiting health facilities, retirement homes. Whereas in Germany, you do need to wear masks in public transport, long-distance trains, hospitals, retirement homes. In Indonesia, not in general, as I think we are aware, and things have been going back to normal. This might be a factor because of the relatively good number of cases that we're having here. In Italy, face masks also required in public transport. I think we're seeing a bit of a trend here in the European countries of face masks required in public transport, but not really inside public spaces. They're just recommended. Green passes, which used to be the thing, is not longer required as well, or there's still high local transmission. In Japan, colleagues there have mentioned that in Japan, there's not much restrictions. You don't need to register or check in using the Kokwa app. They use But if you're coming from overseas, you'll do need to write a written pledge as to install the app called MySOS and to tracking upon arrival for contact tracing purposes. South Korea relatively fine as well these days. And Mexico risk remains national health emergency. There's still some state regulations and restrictions. Colleagues there working in the hospitals shared that no mask mandates except in mass health facilities. You still need PCR to do interventions in the hospital. Saudi Arabia not reported, and I think we are all aware that we do have pilgrims going there at this point in time. South Africa no longer has COVID-19 in this place as well. Turkey, say hospitals, United Kingdom, where I think, as you've mentioned, I'll be visiting very soon to be at Imperial College London, also has no restrictions, whereas the United States, it very much differs among the various states. And I think it relates a bit to probably what's seen as well with regards to Professor Tabrani's presentation earlier, how there's really high number of cases, most so up to some extent contributed by states which do not really have restrictions due to a variety of factors. Next, with regards to international travel, I think earlier we've seen a very nice summary with regards to what's happening in ASEAN. I'll expand it a bit more to G20. In Argentina, you don't need a COVID test or be vaccinated to enter. You just need to show evidence of insurance for COVID-19. In Australia, no requirements as well. In Brazil, only fully vaccinated can travel by air, or you need an exemption. And you need to show proof of that before you fly. So essentially, vaccines are the norm. In Canada, pre-entry no longer required as well if you're fully vaccinated. For ships, which early in the pandemic, we're all aware, is a conduit for a lot of the cases, are no longer banned and can resume as normal. But you might be selected for random testing while you're in the airport when you arrive, if needed. China, it's very difficult. You do have 14-day quarantine still up to some extent, and 7 days as well in the city you will go to as your last destination. And if you haven't been diagnosed, you still need to take 2 nucleic acid tests, 2 days prior to travel, another on the day, and some even a rat test on the day itself or on the spot. In France, if you're vaccinated against COVID, you're no longer required to show evidence of negative COVID tests, although they still have a traffic light for the system. In Germany, Indonesia, you don't need it as well. And if you're vaccinated, I think we are all very much aware of what's happening here. Whereas in Italy, have been lifted as well, essentially. In Japan, and this has been very recent, from just the 10th of June, they're allowing foreign tourists in stages, but this will be limited to guided tours and those from blue countries, including, for example, Australia. And importantly, you will be very strict. It's like a bubble in some sense, where the company organizing your tour will need to sponsor you to come to visit. Whereas in Korea, you still need to provide a proof of negative PCR exam 48 hours before the departure. And I think the other factors, I would say, but no quarantine. In Mexico, reopened to fully vaccinated. In Russia, no PCR if you're vaccinated. Saudi Arabia too, South Africa as well. So essentially, in Turkey too, United Kingdom, you don't need to complete a UK passenger locator and other things as well, and the United States. So essentially, if we see for most of the countries in G20, international travel has resumed, or according to normal, are vaccinated without the need for COVID tests. So the mutual, I think, as mentioned previously as well, how important it is now to make test results mutually acceptable or mutually linked might be less so or less urgent. Whereas for European unions, there's widespread vaccine checks. The digital pass is still there, the green pass, as we're aware, but there remains issues with scanning certificates, vaccine certificates countries. And I think there's room where the European Commission can be encouraged to have this, the rest is, and be a possible platform even for global use. because they've been tested in over 20 countries as part of the European Union, for example. And hence, it might be, I would say, more stable compared to newer products or newer apps out there to scale globally. Something to think about. At the same time, I think from civil perspective, there's probably reasons for this harmonization, which we can understand. Different legislation and within countries. For example, in the US, it's very state-based. Also in Australia, whereas more central in Indonesia. Among others as well, there is limited or difference in reach or how far a government can implement public health orders in countries, even within countries. For example, in Australia, different states have different rules. Some provide fines, some don't, and some enforce different public health orders at different times during the pandemic, and they don't always relate to each other. So I think this is one aspect that G20 member states can also discuss. Certainly, it's also impacted by different healthcare capacities, different compliance with things, but also are there political considerations or economic considerations with regards to this harmony beyond only the evidence or the academic perspective. And maybe what's needed is a framework. There's a list of possible public health interventions. I think the past 2 years has certainly advanced the science of I would say, infection control, of controlling communicable diseases, of epidemiology, and people are now more aware of the options they have. Use this in line with the decision-making metrics to be jointly made to select which to implement on the standard set of consensus rules, e.g. based on vaccine coverage, based on other factors that the G20 states can decide, and then provide frameworks to allow for data sharing across this decision matrix. And this can start with determining international travel, because as we've seen earlier, while some countries have opened up requiring just vaccinations, some don't, and also some even don't require any evidence at all. And transparency, from our perspective, would bring stability and also support economic return. But what we think as well is the way forward. We should not forget COVID-19 has brought tremendous healthcare burden. There's a lot of collateral health effects from this directly with overburdened infrastructure, but also health professionals. Infectious diseases beyond COVID-19, such as tuberculosis, have risen and has reversed years of progress made in the fight to end TB. Although we hope learnings from COVID-19 can be implemented also in the TB space. Secondly, diseases as cancer, lupus, arthritis, other injury-related problems, acute illnesses, heart attacks, diabetes, they became a bit forgotten due to COVID-19. And I think we need to remember that they still exist and are taking time bomb. Supply chain issues as well, that has been a result of COVID-19, but also other things, including, I think as we're all aware, the war in Europe, in parts of Europe, and also other disruptions in the supply chain and shipping industry. Adult disease treatments have been deferred. There's increased need for other services as well. I think this all should be part of the thoughts, I would say, of what's considered when determining what's to prioritize among this working group. And also, I think the same, we can see that COVID-19 has accelerated a lot of digital health trends, which I'm happy to see has been also implemented in Indonesia, but I think they need to be crystallized and can be more even faster to benefit. And also at the same time, I think COVID-19 brings a once in a lifetime opportunity for us in health to change things, to rethink things a bit, because we start a bit from a clean slate. And I think we should use this opportunity to integrate many of these trends and emerging technologies to improve care outcomes and increase efficiency. In conclusion, we can see that limited restrictions are there with regards to internal mobility in G20 countries. No quarantine requirements for many. Some don't even require vaccination proof. Gaps remain in digital document verification, but also opportunities to work with existing systems and globalize them. Transparency can provide stability, including by providing clear decision matrices. There's need to think on solutions to reduce collateral impacts of COVID-19 and leverage existing technologies and emerging technologies, which development and uptake is accelerated during COVID-19. And thank you. And just as a closing remark, adding technologies have made it possible for COVID-19 within the past 2 years to be, in most parts of the world, not really deadly. But at the same time, we need to remember that inequities exist and we should accelerate making it not deadly everywhere. Thank you, and I hand over back to Henry.
Okay, then. Thank you, Dr. Anthony. Yeah, too nice the presentation. Interesting, yeah, because you show any countries that having any further about the COVID-19 post-pandemic. Okay, thank you. Okay, ladies and gentlemen, now come to Q&A session. Okay, I would like to have 3 questions from participants. There are any question, and also you can write down an Q&A box if you have. Okay, I don't see any in the Q&A. Okay, maybe I ask one question to all presenter. What do you think if world is stuck with the privacy restriction, and after that pandemic come through again? How about that? Maybe from Dr. Imran, or also maybe Prof. Sabrani or Dr. Anthony, please.
Yes. Sorry, Pak. Can you repeat because it's interrupted your signal?
Okay.
Okay.
What do you?
Yeah.
Yes. What do you think is the word? Word means like a word is still stuck with the privacy restriction about health data. How about that? So we to have another stage is yeah, this is the answer that like impossible to do, but what we should do now after that. That's it, Dr. Imran.
Yeah, maybe I can respond about the question first. Yeah. So I think the first point is we cannot. Oh no, we should move on. Yeah, we should move on. Even though maybe nowadays, like Prof. Hasbullah mentioned that the numbers of the positive COVID now is increased, but in fact that in Indonesia and also maybe in Singapore also, like here now, the fatality rate and also hospitalization rate is also still low. It means that even though the positive rate is getting higher, but the fatality is low. It means that we should still continue our health protocol, and also we should try to what I say, living with the pandemic thing. Yeah. And the other things that we should do is about for the privacy restrictions. We have to use safe means that we use about the especially about data. Yeah, we should start about how we can share the data with other countries, but in the security manner. Yeah, and we should have like a discussion like that we tried to do in the G20 about how we can share data with the federated like what I explained. Yeah, but it's still should be in the safe manner, and also with the control of the what we call respected organization like the WHO, OECD, and also GTHC. And the third, I think, we should also try to expand the use of this data to what we call to prepare or maybe to prevent for the next pandemic. Even though we don't want to have a new pandemic, but yeah, we cannot predict what we have the future. I think that's my response. Thank you.
Thank you, Dr. Imran. Also, I would like to invite Professor Hasbullah to answer.
Yeah, Bani. Individual data restrictions must be understood as for some data, yes, it is. For example, medical record data belong to individual. So anyone other than the person cannot and should not share the medical record data without consent of that individual. But what we'll share is not individual data. We will share the aggregate data, the claim data, or we can share the virus genome or DNA data. So the virus data, for example, we have a new mutant in Indonesia. Certainly, we have to share to other countries right away, so other countries can identify. And probably if there is a serious with the new mutant, then vaccine industry can develop a new vaccine, for example. That's a must, but not medical record, for example, what Hasbullah suffered from this COVID and this comorbidity, so that's not bad. So we have to educate the public that we will not share individual data. Because for Indonesia, after there were leaks of the individual data, often people complaining about this mistakenly. Yeah. Thank you. Over.
Okay, thank you, Prof. Hasbullah. Yeah. And then I would like to invite Dr. Anthony.
Sure. There's a few,
the question. Yeah.
There's a few possible ways with technology, among others. We can share de-identified data as well, as has been done in many places, or more recently also use common data models. If people adopt common data models, you can do federated analysis. So you have the code and your analysis plan in the center, but analysis is done on-site or in the particular countries, and then the federatedly, and then the data brought back, but just the aggregate results, as maybe Professor Hasbullah alludes to a bit earlier. But essentially, the identified data using federated analysis methods through adoption of common data models can be some options with regards to privacy. But also that I think we should have and build that trust between governments, data custodians, and the public. In the end, as long as I think we remain prudent in how we store data, to common data standards, and also as long as we can build that trust. I think that's the biggest problem these days, because at the same time, we see that people share their data online, right? Through Facebook, through social media, through other online channels, but they don't really think of this privacy stuff. Only when it relates to, often, I must unfortunately say, government, people become very worried, right? That, you are keeping our data and you're storing it. So I think building the trust as well is the third part to all that.
That's it. Thank you. Okay, then. Okay, I think time is limited. And then thank you for becoming a speaker, Dr. Imran, Prof. Hasbullah, and also Dr. Anthony, to become our guest speaker now. And then I think I will go to next session, next agenda, and I will give the session to Mr. Ading to continue the next agenda. please, thank you for all about this presentation now, and good day. Thank you.
Okay, thank you very much, Mr. Handy, for great moderator in this session. Yeah, we know that we have already discussed for about harmonization and strengthening of global health standard and recognition protocol from 3 different perspectives, from Ministry of Health perspective, academician perspective, and public representative. Ladies and gentlemen, this is the end of our webinar, but before it, I would like to invite Professor Fatma Lestari to delivering the closing statement. To Professor Fatma Lestari, stage is yours.
Thank you very much, Mas Ading. Thank you very much, Bapak Dr. Hendy Wijaya, for moderating the second session. Thank you very much also, Dr. Brian. I think we come to an end to this workshop today. Thank you very much also for your strong participation and active participation. But please contribute your opinion, your recommendation to our online survey. Maybe OSI can help to share the links for the OSI can help to share the online survey, please. So we invite you to participate and provide recommendation for the G20 harmonizing in global health standard protocol and recognition. So, and also please invite your colleagues, your networks to join this very important survey so we can provide G20 to our based on evidence-based. Thank you so much once again. Thank you, Mas Ading.
Thank you very much, Professor Fatma. Finally, ladies and gentlemen, this is the end of our agenda. We would like to thank again for our speaker of the day, our moderator, as well as the parties that contributed for today's event. We also thank you for all participants in this webinar, and we apologize for any inconveniences in today's webinar. As a reminder, all participants are expected to fill in the attendance on the link that we have already sent to the chat column, and the certificate will be available on the 2nd July of 2022 or tomorrow via the following link at ddrc.ui.ac.id/certificate/. Yeah, I think this is the end of our agenda. It is concluded that event today organized by Disaster Risk Reduction Center, Universitas Indonesia or DRRC, the Faculty of Public Health Universitas Indonesia, and the second ITTP conference COVID-19 supported by the Director of Research and Development at Universitas Indonesia. Thank you very much. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. See you on the next webinar.
Waalaikumsalam. Terima kasih banyak Pak Imran. Thank you, Dr. Imran, Dr. Brian,
Thank you very much, Bu Agustin.
Fotonya belum,
fotonya. Prof. Sila udah nggak ada ya?
Fotonya belum.
Ya, foto lagi, Bu.
Foto lagi.
Itu bukan foto-foto. Ya.
Foto lagi ya, Bapak Ibu ya.
Iya, Prof. Abdullah udah berangkat.
Wah, Bu Agustin nih sampai akhir nih join terus. Makasih, Bu.
Ya, 2.
Itu ya, boleh share bahannya ya, PPT-nya bagus-bagus.
Iya, siap Bu Agustin.
Oh, nanti kita jadi satu report ya. Tadi bagus
Insya Allah
banget.
Ya.
Karena Pak Prof. Eko kan melihat dari sudut regionalnya juga gitu ya, regional ASEAN, jadi bagus lah.
Makasih Bu, makasih banyak. Makasih.
Oke, sama-sama. Terima kasih semua.
Imran.
Terima kasih Pak Fatma. Terima kasih Pak Hendy.
Terima kasih Dr. Antoni.
Terima kasih.
Terima kasih Pak Agustin.
Brian,
Prof. Hasbulan.
apa dong Bu Brian?
Ya nih gantian.
Iya, ini udah mulai ngedobel jam segini.
Tadi ngedobel.